Namaste and welcome everyone. This is the third week of this very informative International Yoga Conference held throughout the month of June as an extended celebration of the International Yoga Day, hosted by the American Academy of Yoga and Meditation. For those who are joining us for the first time, let me introduce you to the American Academy of Yoga and Meditation, or AAYM as it is called. This is a non-profit organization dedicated to education and research in the field of yoga and meditation by fostering an interdisciplinary approach of linking science, arts, ethics, and spirituality to promote human well-being. And I'm very happy to host this webinar on yoga in hypertension. According to the World Health Organization, hypertension is a serious medical condition affecting around 1.13 billion people worldwide. Uncontrolled hypertension can cause heart attacks, stroke, and also other complications such as aneurysms, kidney disease, and even blindness. Yoga practices, which include asana, pranayama, meditation, are rooted in mindfulness and are effective in managing one's overall health. These practices have shown in various studies to reduce the systolic and diastolic pressures and to improve cardiovascular health in general. Today we have four very eminent speakers who will be sharing their knowledge and wisdom with us. I will name them first: Dr. Robert Schneider, Dr. R. Nagaratna, Dr. Kashinath Metri, and Dr. Laura Tolbanos Roche. I hope I pronounced that right, Dr. Roche. But before we do that, let me introduce to you our moderator for the session, Dr. Praseeda Menon. Dr. Praseeda Menon has spent the last 8 years as a research officer at the Scientific Research Department of Kaivalyadhama Yoga Institute and Research Center in Lonavala, India. She has a PhD in psychology and a postgraduate diploma in yoga and Ayurveda. She has also studied Buddhist psychology and ethics. She conducts collaborative scientific research on the efficacy of yoga in holistic health, healing, and well-being. Some of her research work at Kaivalyadhama deals with the psychological impact of mind-body interventions, focusing on the impact of yoga on non-communicable diseases. And mindfulness in relation to personality factors and the efficacy of yoga practices in children with intellectual disabilities. Let me welcome Dr. Praseeda Menon, who will be introducing all the other speakers in turn. Thank you.
Thank you so much, Dr. Raji. And namaste to all you viewers out there who are taking the time to join us in this third week. And the American Academy of Yoga and Meditation highly appreciates you taking the time to join us today for this webinar on the role of yoga in hypertension. And this is the International Day of Yoga 2021, so we welcome you to this webinar. And it is my real privilege to be able to share this online dais with all our eminent panelists today, engage with all you viewers out there, as well as moderate this webinar. So, did you know that hypertension is a silent killer? Because most hypertensive people don't perceive any symptoms of hypertension at all. And did you know that hypertension is behind 45% of global deaths due to heart disease and 51% of deaths due to stroke? Well, did I scare you? Just relax and take a long, deep breath. Because in the next 75 minutes today, we will look at how the ancient science and philosophy of yoga has been used and can be used by each one of us as a holistic way of life, as well as mind-body holistic medicine to prevent, manage, and cure hypertension. With thoroughly researched knowledge that our brilliant panel today will share with us, all of us at AAYM trust that each one of you will take back with you the yogic tools and learning for that which plays a key role in hypertension and related ailments. mind-body balance. So, let me introduce our first speaker in the panel today, Dr. Robert Schneider. Dr. Robert Schneider is an internationally renowned physician, scientist, educator, and leader in evidence-based integrative medicine. He is currently the Dean of the College of Integrative Medicine at Maharishi International University and the Medical Director of the Institute for Prevention Research. Beginning way back in 1984, Dr. Schneider was one of the first physicians in the US to practice, teach, and research Maharishi Ayurveda. He has directed or co-directed more than $25 million in grant support for clinical research on mind-body medicine, aging, and cardiovascular disease, the results of which have been published in 175 plus peer-reviewed articles, chapters, and abstracts. In recognition of his contributions to preventive cardiology, Dr. Schneider was elected a Fellow of the American College of Cardiology. He is also the author of the popular book, Total Heart Health: How to Prevent and Reverse Heart Disease with the Maharishi Vedic Approach to Health. And he is also the senior editor of a forthcoming book, Integrative Ayurveda, a textbook for physicians and health professionals. So Dr. Schneider will share with us the accumulated evidence base of transcendental meditation, which is an ancient yogic practice, and how it relates to heart health. Over to you, Dr. Schneider.
Hello, I'm Dr. Robert Schneider, Dean of the College of Integrative Medicine at Maharishi International University in the United States. And it's a pleasure to be here with everyone at YogaCon. And today I'd like to discuss with you the topic of yoga and heart health. And today we're going to talk about a review of the evidence for transcendental meditation, a traditional yoga meditation practice on cardiovascular health, a review of the scientific studies. Meditations have been in the news for the past several years. The American Heart Association reported that meditation may decrease the risk of heart disease. Well, what is that and how does that happen? First, what is meditation from the yoga tradition? According to Patanjali in his Yoga Sutras, the state of yoga is the least excited state of consciousness. Well, how do you experience that? Patanjali describes a method that is now practiced as transcendental meditation, which is a technique that allows the mind to settle down to a least excited state of consciousness, to a state of inner quietness, silence, to the state of samadhi. And the state of samadhi is described as a fourth major state of consciousness, a wakeful hypometabolic state where there's unique EEG pattern and changes in blood chemicals, respiration and metabolism, and galvanic skin resistance, which is a measure of sympathetic nervous system activity. And these changes during samadhi in meditation are different from ordinary rest and relaxation. And actually, different forms of meditation have been found to have different neurophysiological effects. And in this study, Travis and Shear reported on 3 kinds of meditation, those which involve focusing or high levels of effort to hold the mind on an object, whether it's a visual object or image or auditory, is associated with gamma patterns of the EEG, whereas open monitoring or observing found in mindfulness practices from the Buddhist tradition are associated with theta patterns of the EEG. And this yoga practice of automatic self-transcending is associated with alpha patterns in the EEG, characteristic of restful alertness. Furthermore, these alpha patterns are coherent between different parts of the brain. front and back, left and right. So different types of meditation have different effects on the brain, and that has different effects on the cardiovascular system. First, let's look at blood pressure. This was a study, a randomized controlled trial conducted a number of years ago, where my colleagues and I randomized patients with high blood pressure to 3 different practices, follow them for 3 months. The education control group on top had no change in their blood pressure over 3 months. Progressive muscle relaxation had a small but significant reduction in blood pressure. And then the yoga meditation group had a significant reduction of about 10 millimeters in their blood pressure. So different effects on blood pressure, different practices. Samadhi was right there in lowering BP over 3 months. Since that time, there have been 12 randomized controlled trials on this form of transcendental meditation and blood pressure. This is a meta-analysis of 11 of those trials in patients with high blood pressure or hypertension, showing on average there was a 7 millimeter reduction in blood pressure, systolic, and a 5 millimeter diastolic reduction amongst 900 participants in these trials. This came out in the Journal of Human Hypertension a few years ago. The American Heart Association reviewed these trials of various meditation and relaxation methods and concluded that alternative treatments that include the transcendental meditation technique are recommended for consideration in treatment plans for all individuals with blood pressures greater than 120/80. And actually, 40% of the American population and the European population, and likely that many, almost half of adults around the world, have blood pressure that's now considered high, greater than 120/80, who would benefit from an effective meditation practice for their high blood pressure. Let's look at comparative effectiveness studies of different meditation and relaxation techniques. This was a meta-analysis of all the published trials on relaxation techniques and BP done at the time, looking at biofeedback, stress management, muscle relaxation techniques, and transcendental meditation. 107 studies were identified. 17 trials met criteria of strict design criteria. Results show that biofeedback, stress management, and muscle relaxation had non-significant effects on blood pressure, whereas this transcending or samadhi-based meditation had a significant effect in lowering blood pressure under very strict scientific criteria. The American Heart Association took note of this evidence and reported in their scientific statement that the transcendental meditation technique is the only meditation practice, including mindfulness-based stress reduction, that has been shown to lower blood pressure at the time this review was done. Other techniques had insufficient data, means we don't know, but their data was insufficient to make a conclusion based on these criteria, or had non-significant effects on lowering blood pressure. So if you're looking for an evidence-based practice, here you are. Let's look at behavioral risk factors now. This was a study of mindfulness-based stress reduction approaches and transcendental meditation on anxiety, showing that mindfulness practices do reduce anxiety. And this traditional yoga-based practice also reduces anxiety, and it looks to be about twice as great of an effect on that psychosocial risk factor for heart disease of anxiety. Let's look at cardiometabolic disease. Now, insulin resistance, a major risk factor for CVD found in patients with prediabetes and type 2 diabetes. This was a randomized controlled trial published in the Archives of Internal Medicine, an American Medical Association journal, showing that patients randomized to health education had a greater, rather, let's say, patients randomized to meditation had a significantly greater reduction in insulin resistance compared to controls. And this is very important for their risk for heart disease through cardiometabolic pathways. It's now recognized in the United States and around the world that there are disparities in cardiovascular disease. All racial and ethnic groups in every country of the world, in every continent, have CVD as a #1 cause of death. And if you look at subgroups, African Americans have even higher rates of cardiovascular disease, likely related to stress and other social determinants of health. That's why we conducted a randomized controlled trial of patients highly at risk for heart disease and randomly assigned them to either health education or meditation, and we followed them for 5 years. The red bar shows rates of heart attack, death, and stroke in the control group compared to the blue bar, which had practiced meditation combined with usual medical care, showing a 48% lower risk of the endpoints of death, heart attack, and stroke. So the reductions that we saw earlier in blood pressure, in insulin resistance, in other cardiovascular risk factors, in psychosocial risk factors, all affect the bottom line of death and non-fatal events of heart attack and stroke. Simply by adding this yoga practice, this samadhi-based practice of meditation to usual medical care. In conclusion, today we've reviewed meditation for heart health, and I believe we've seen that this experience of samadhi through transcending is the key to changing the brain, changing the heart towards higher states of well-being and higher states of heart health. So all the best to Yoga Khan, and namaste.
Thank you so much, Dr. Schneider, for providing all our viewers such a compact yet comprehensive review of the effect of transcendental meditation in heart health. I'm sure it has inspired all of us to learn TM and practice it as well. And I would like to tell our viewers who have joined us today that please feel free to post your questions through the chat box. You may also mention the name of our panelists to whom you want to pose the question. We will be happy to address all your questions towards the end. So let us now move on to our next panelist, Dr. Nagaratna. Dr. Nagaratna is the Medical Director of Arogya Dham. It's a holistic healthcare center, the Dean of the Division of Yoga and Life Sciences, and Professor at Swami Vivekananda Yoga Anusandhan Samsthan, which is also popularly known as S. Vyasa University, which is based out of Bengaluru, India. It's a premier institute for yoga research, therapy, and education, both in India and the world. She has to her credit 10 large nationally and internationally funded projects in yoga research and is presently a co-investigator in an NIH-funded cancer research study. She has expertise in developing, validating, and standardizing yoga modules for various common ailments as well as testing their efficacy in various clinical populations. She has done research in several areas like psychoneuroimmunology of yoga, yoga and cancer immunogenomics, yoga and non-communicable diseases, etc. She is a recipient of several awards, including Kannada Rajyotsava Award, Woman of Excellence, Vidya Varenya, and so many others. She is popularly known as Didi in the yoga circles, meaning elder sister, and she truly exudes such yogic warmth to one and all. So over to you, Dr. Nagaratna Didi.
Hello, namaste. Let me start my presentation. Welcome to all the viewers to this presentation on yoga for hypertension and heart disease, which is the topic for today's panel discussion. What is very important for all of us to know on this occasion of the welcome to our S. Vyasa University campus, which is 100-acre campus, which hosts Arogyadama and the research activities at the center. What is very important for us to know today is the AAYM is heading forward to impress upon the world at large how they should change their lifestyle to prevent hypertension, to help us to move towards better health and not go into complications of heart disease. We have all been talking about hypertension. What is the cause? Why are we talking about doing yoga for hypertension? Because as you see there, the cause of the hypertension, there is a hereditary tendency. It's only at the background and it is an aging problem. But what makes this background manifest is the lifestyle, which includes diet. In the diet, it is excessive salt intake, high cholesterol diet, and obesity, which is the most important thing. Everybody knows about junk food. Junk food, junk food, junk food. Why are we talking so much about junk food? It's not dirty food, it's not unclean food, but it is becoming a toxin once it goes in. Smoking is well known, and stress. In stress, it is the type A personality. I see a large number of participants with hypertension. The biggest, see, when we meet somebody with hypertension, we take their detailed history, and as Praseeda has told, hypertension is a symptomless disease. But when we talk to them, we ask them, do you have any stress? It is the cardiac problem participants or the hypertension participants who say, I have no stress because I am a highly ambitious, successful, productive, workaholic person. I enjoy my life. There is absolutely no stress. How many hours do you sleep? I sleep 3 hours a day. How many hours do you sit in front of the sedentary lifestyle? It is, I'm always working, 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 working. Do you get good sleep? No. When I go to bed, I take a long time because my mind is always planning, scheming. And early morning when I wake up, they don't usually wake up very early in the morning, of course. I get wonderful ideas. Immediately I get up, get onto my computer, start putting in my creative ideas. This is the successful, productive, very, very highly placed personalities who don't even recognize that how much they are overworking this part of the system rather than working any physical thing and develop obesity, etc. And what medical science has clearly understood is how this mind can work on the body. It is when we thinking, planning, scheming, and get into emotions, when we are rushing towards our targets and deadlines, what happens is it gets into the higher level of emotions. If somebody is not, I always ask persons, sir, you are a very big perfectionist. I can see you have achieved so many things in your life. And what happens if your assistants, if your colleagues do not come up to your expectation? They say, wow, I blast them, I throw them out of my job situation. I get irritated, I use irritability or anger to throw them out. This, they are using the anger so they don't even feel that it is overwork on the brain. but it is causing so much of chemical imbalance, releasing lot of nervous activities which activates the hypothalamus and shows up as constriction of the blood vessels, sympathetic activity, etc. And all this is therefore based on the mind. Mind is the root cause, and even in coronary artery disease, the problem is again the big risk factors of lifestyle, excessive smoking, obesity, hypertension, blood lipids, diabetes, sedentary lifestyle. Therefore, stress, the mind, is at the root cause of heart problem. And in all these coronary narrowing also, as we go on aging, there is a natural blockade that happens. But as we are leading a healthy lifestyle, if somebody dies at the age of 100 years with a cardiac attack, we say, wow, he has lived a healthy, happy lifestyle. But what do we see today? What should have happened? The blockages of the arteries at the age of 100 years is happening at a very young age. All this has been very clearly understood in medical science, but what is very important for us to know is how this to be managed, how we should be able to understand this in the yogic language, and how we should be able to prevent, reverse, and prevent the complications. So in both these, yogi said this is called as adhija vyadhi. The body level is where there is lot of tightness in the peripheral arteries called peripheral arteriolar spasm, which causes hypertension, or inflammation in the lining of the arteries, which is also violence at the physical level. That is due to excessive prana activity at the pranamaya kosha, which is due to too much of activity at the mind level, emotions, suppress long-standing emotions. So what yoga tells us is how to slow down and come to a state of shanti, come to a state of calm state of mind where we use lot of techniques. The whole of the summary of yoga techniques is to see how we balance the whole system through slowing down the activity at the mind level to get mastery over the modifications of the mind, mastery over these emotional surges by the process of slowing down. See, this personality problem that I talked about, they all know that there is emotion. They know that there is a lot of violence in the mind, and they are such strong-willed people that they are able to push that emotion, suppress this emotion, push the prana activity down to the physical body, which settles down in the arteries, and that is the big problem. So what the sages said is, at all levels there is lot of violence. Mind is working very, very fast, uncontrolled, speeded up activity, which activates the prana, and excessive prana drainage, which shortens the life also. And that settles down in the arteries as inflammation or muscle spasm. So it's all violence, violence, violence. And they design beautiful techniques. This much medical science understand that it is all violence here, violence at the body level in the form of inflammation, fighting, endothelial dysfunction, etc. But what we do not know in medical science is how to handle this monkey mind, how to handle the mind. This is where they develop large number of techniques. Asanas is one set of practices which is very, very important. And when we try to prepare asanas, very important to remember the negative effect of asanas in each disease. In hypertensive, we avoid forward bending, we avoid acute dynamic practices, we stick to a basic set of 30 to 40 minutes of physical practices, 10 minutes of deeply restful practices, and 20 minutes of meditation, and a total awareness throughout the day, adapting bhakti yoga, the devotional yoga, the work yoga, and also the conceptual correction at the mind level as to why am I rushing and speeding in life? What is the purpose of life? What is the meaning of life? This is what we call as Samagra Yoga or integrated yoga, where we work at the body level, breathing level, mind level, emotions level, intellectual level, etc. And when we are selecting the specific physical practices, we should be very careful that we don't allow the system to get hyperactivated and increase the blood pressure. Therefore, we avoid all acute bends, avoid all dynamics, and in Kriyas, there's a very common question that many people ask us: does Kapalabhati increase blood pressure? Yes, if you're a novice, if you're doing at a rate of more than 60 per minute, definitely it has been shown that it increases the blood pressure. But if you're a trained practitioner, even then, if somebody has developed hypertension, make it not more than 20 to 30 strokes per minute is the understanding. So, doing all these deeply meditative practices, beautifully, Dr. Schneider has shown how the hypometabolic state, resting state, calming down state, silence of the mind, very beautifully brought out in the Samadhi concept, where you go into zero thought state, is the one which brings about all these changes. This slide shows how, if you sleep for 6 hours, you get about 10% rest as measured by oxygen consumption. If you do Shavasana, you get about 11% rest. When we taught them cyclic meditation, which is based on a traditional concept from sage Gaudapada, we were able to show that there was a 30% reduction in the oxygen consumption. And this is possible through breathing techniques, asana techniques, meditative techniques. And what is pranayama? Pranayama is not just fast breathing, but it is basically defined as Shwasa Prashwasayoho Gatirvichedaha Pranayamaha. Slow deep breathing, mastery over excessive speed, balancing the prana, etc. As I said in the cyclic meditation, one of the very beautiful techniques that Saint Narada promotes is Parama Prema Rupa Bhakti. When you are in the divine mode of pure love, the entire metabolism comes down, and that is what is going to help us get total mastery over our emotions. So this is the whole process that we work on and help people to work on. So to summarize, it is all the silence, 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 silence that is beautifully brought out by Schneider. And practicing this silence at work, while at work, how you can maintain that background silence is something which needs lot of understanding and practice and work on this. My dear friends, on the occasion of this International Day of Yoga, I hope that all of you will take a vow that I am going to spend at least 45 minutes every day for my regular practice, only 7 days a week, please, so that it becomes a practice for all of us, just like we brush our teeth, just like we have our breakfast on a regular basis. Regularity, when I talked about breakfast, I remember today that has also become a big issue. Healthy, timely, homemade, vegetarian diet is very, very important, is what we have understood. Wish you all the best. I hope with this effort from the AAYM, there is a big awareness that develops in the society, and many yoga practitioners who are listening to this seminar will make it a sadhana, make it a practice that not only you practice, but you spread this to a large number of people so that we move towards making the world a happy, healthy mode. And that is the motto of IDY logo. In the logo, you can see what is yoga. Yoga is for health and harmony. Harmony within the system, harmony outside, harmony between people, harmony between nations, harmony between the universe, harmony between the nature and man, which is creating all the problems we are going through. On this occasion, let us all pray that this pandemic will go away with a healthy lifestyle. Thank you.
Thank you very much, Dr. Nagaratna Didi, for that wonderful, wonderful presentation. And thank you so much for emphasizing the importance of practice for greater balance, harmony, and peace that all of us need in our life, both within and without. And we join you in that prayer for our humankind. Thank you. I would like to remind all our viewers who have joined us today to please feel free to post your questions through the chat box, and we'll be very happy to address all your questions towards the end. Let us now move on to our next panelist, Dr. Kashinath Metri. Let me give you a small brief about Dr. Kashinath Metri. Dr. Kashinath Metri is an excellent example of the marriage of yogic and Ayurvedic wisdom, as he is an Ayurveda physician with a doctorate in yoga. He currently holds the position of an assistant professor of yoga at the Central University of Rajasthan, India. He is actively involved in research in yoga therapy with 50 plus peer-reviewed publications in the area and has guided many research scholars in their master's thesis. He regularly offers yoga therapy consultations and has designed several yoga modules for chronic disorders such as Parkinson's disease, ankylosing spondylitis, asthma, hypertension, and heart disease. With a very strong base of both yoga and Ayurveda to his credit, he is a much sought after lifestyle consultant for chronic health ailments like heart disease, diabetes, asthma, depression, anxiety, and you name it. His passion is to inspire young minds through his teachings on yoga therapy. Dr. Metri, today in this webinar, will explain 4 specific body-mind mechanisms that are responsible both for producing and sustaining the pathology of hypertension, as well as for producing the effect of yoga as a comprehensive intervention in hypertension. Over to you, Dr. Metri.
Namaste. I welcome you all to this webinar. The topic of my presentation is Yoga, a comprehensive intervention for hypertension. Now, why I chose this title that you will understand by the end of this presentation. Friends, yoga reduces high blood pressure, yoga reduces heart rate, yoga is effective in hypertension. This is very well known to scientific community and also common public. But in this presentation, we will understand that how yoga corrects the pathology. That means the changes in the physiology which actually led to sustenance of the hypertension and which causes the complications of the hypertension. So can yoga reverse those pathological changes that we will see in this presentation? As all you are aware, hypertension is a chronic sustained blood pressure, elevated blood pressure. Now, the consequence of this is by damaging the blood vessels. Because of the sustained hypertension, the blood vessels, the major blood vessels which essentially supplies blood to our vital organs such as brain, such as heart, such as kidneys, got damaged. And because of that, these organs becomes damaged and leads to serious problems such as heart disease, stroke, and kidney failure. Hence, hypertension is a very major problem around the whole world. In fact, it has affected more than 1/4 of the global population. And consequences of hypertension, complications of hypertension are very serious and life-threatening. Hence, we are discussing hypertension today. I was telling you that there are pathological changes that happens in the hypertension, which actually leads to increase in the blood pressure and maintenance of the hypertension, and they also contribute to complications or the end organ damage due to hypertension. And these pathological changes are autonomic dysfunction, cardiac autonomic dysfunction, dysregulation in endocrine functions, that is hypothalamo-pituitary adrenal axis, and atherosclerosis. Now, these are the four primary changes that happens in our body function that actually becomes the cause of the hypertension, maintenance of the hypertension, and they also leads to complications of the hypertension. Let's understand these things one by one. What is autonomic dysfunction? Now, we have a nervous system that involves the brain, the spinal cord, and the nerves. So nervous system helps to function all the vital organs and all the body organs. Now, nervous system, by receiving the signals from all the parts of the body and outside, and makes the necessary changes in the organs. Now, it acts in two ways. Now, whenever we are into emergency situation, such as a tiger comes in front of me, now I have to respond. Now I have to either run away from the tiger, or I have to, if I don't have an option of running away, I have to fight with the tiger. This is called as flight or fight response. Now I have a situation, stressful situation, tiger, I have to fight or flight. Now, in order to do that, in both the cases, I need my blood pressure to go up. I need my heart to beat faster so that I can supply blood to the brain, heart, and muscles. I need more energy, more glucose. I need more muscle strength. I need more attention. Now, all these changes are brought into my system by sympathetic nervous system, by sympathetic activity. Now, when I don't have any such emergency situation or any such stressful situation, and I want to relax myself, I want to do meditation, I want to do relaxation, I want to sleep, then I need my system to calm down. Now, that is done by the help of parasympathetic nervous system. Now, what is autonomic dysfunction? Is we have more sympathetic overactivity and less parasympathetic overactivity. Less parasympathetic activity. That is what happens in the hypertension. In hypertensive patients, the sympathetic activity is more, even though they don't have any emergency situation, but their system acts as if they are having the emergency situation. So their blood pressure is always more, their heart rate is always more, their muscles are always tensed, they are able to relax themselves because the parasympathetic activity is very poor. This is called as autonomic dysfunction. So this is an imbalance. Now, what is cardiac autonomic function? Cardiac autonomic dysfunction. Cardiac autonomic function is actually the brain-heart communication. Now, whenever there is an increase in the blood pressure, the heart by means of blood vessels, by means of baroreceptors, tell to the brain that there is an increase in the blood pressure. or increase in the heart rate, or there is a change in the cardiovascular system. Now, when brain understands that, when brain receives the signals from the heart, it sends, it makes the necessary changes in the blood pressure. So if the blood pressure is going up, it reduces the blood pressure, it reduces the heart rate, it relaxes the body, it relaxes the blood vessels so that the blood pressure can be brought down. Now, this is the heart-brain communication. This is called as cardiac autonomic function. Now, in patients with hypertension, this is impaired. So brain and heart communication is poor. Even though blood pressure is going up, heart fails to communicate to the nervous system. Even if the nervous system is receiving the signal, the nervous system fails to bring down the blood pressure, which usually normally has to happen. Now, this is cardiac autonomic dysfunction. This is what is commonly found in patients with hypertension. Now, next is the hypothalamo-pituitary adrenal axis dysregulation. Now, this is the hormonal axis in our system, which involves the hypothalamus, it's a part of the brain. It involves the pituitary gland, and it involves the adrenal glands. Okay. Now, this system essentially it is also a stress coordinator. So whenever we have encounter any stress, now this HPA axis makes the necessary changes by producing stress hormones. Now these stress hormones are released by adrenal gland. So these stress hormones are cortisols, adrenaline, noradrenaline, aldosterone. So all these stress hormones get activated, and they increase the blood pressure, heart rate, blood volume, and they also bring makes the ionic imbalance, that we retain sodium more in the body, and they also makes the arteries stiff. Okay. Now, in the hypertensive patients, the HPA axis is always at higher state. So it is always producing more stress hormones. Okay. It is hyperactive. So stress hormones are produced more. That's why the ionic imbalance, the arteries become stiffer. That becomes a kind of permanent change. Okay. Then we have atherosclerosis, is a deposition of the cholesterol in the blood vessels, and thickening and hardening of the blood vessels. So when the blood vessels become thick and hard, they lose their elastic nature, elasticity. So that's why the blood pressure goes up. Okay. Now, what is yoga? As you all are aware, yoga is a holistic science. Okay, it is a lifestyle strategy, because practice of yoga makes us to adopt good habits, promote us to eat healthy food, motivate us to quit the addictions like smoking, alcohol, drug addiction, or it can be mobile addiction. So it helps us to adopt a healthy lifestyle. Hence, it is a lifestyle strategy also. It promotes us to eat healthy food. Now, yoga practice involves the asanas, yogic postures. It also involves the breathing techniques. And it also has the mind practice like meditation. We have various kinds of meditation nowadays. A yogic discipline brings the balance, brings the coordination in the speech, action, and thinking. We speak what we think, and we do what we speak. Okay. And it also helps to enhance the physical health, the mental health, and also spiritual health. So you might have seen that the people who practice yoga, they tend to have more inclination towards spirituality. Now, this is the research base. There are many, the significant number of the researches are being done in the field of yoga and how yoga helps in the hypertension. Yoga, particularly in the autonomic dysfunction, so increased sympathetic activity and decreased parasympathetic activity is the autonomic dysfunction. Now, what is being observed, people who practice yoga regularly, they have the sympathetic activity comes down and parasympathetic activity goes up. They are more relaxed. Their arteries are more relaxed. Their blood pressure comes down. So their respiratory rate comes down. This all can happen only because of the autonomic balance. In fact, one of the definition of yoga is samatvam yoga uchyate. That means balance is yoga. Balance in the diet, balance in the thinking, balance in the emotion, balance in the physiology. Imbalance is pathology, imbalance is disease, balance is health. That is what Ayurveda says. Okay, so yoga brings the balance in the autonomic nervous system. So whenever you require, your sympathetic activity will go up, but whenever it is not required, it comes down and parasympathetic activity goes up, which is not there in the hypertension, but by practicing yoga, it get established. Okay, so this is how yoga reduces blood pressure, reduces heart rate, reduces respiratory rate, reduces the rigidity in the blood vessels. Now, what researchers are also found that when we practice yoga, the cardiac autonomic function, that means the brain, heart, coordination, communication improves. People who practice yoga, their heart is able to communicate to the brain that there is a variation in the blood pressure, please take care of it, and simultaneously the brain also takes care of that. So whenever there is an abnormal increase in the blood pressure, brain, by reducing the heart rate and by making the blood vessels relaxed, brings the blood pressure down. So this is the heart-brain communication, which gets improved when we practice yoga, when we practice asana, when we practice meditation, when we practice pranayama. So the cardiac autonomic dysfunction improves. Our internal organ intercommunication get enhanced. That's the beauty of the yoga. Then HPA axis, so hypothalamo-pituitary adrenal axis. What is being found that people who practice yoga, their stress hormones, the adrenaline, the noradrenaline, the cortisols, the aldosterone, the renin, all these gets reduced. So that means the bad effect of these hormones, these hormones get reduced. So when the adrenaline, noradrenaline, cortisols goes down, our kidney starts functions normally. The blood vessels get relaxed, the heart rate comes down, and the body volume also becomes normalized. The heart functions get normalized, and the blood pressure comes down. And this is how it corrects the internal pathology in the hormonal, in the endocrine functions. Okay, it also improves the endorphins, that feel good, the hormone which makes us feel good, feel happy. So it enhances that. It also enhances the nitric oxide in the blood vessels. So blood vessels becomes wider so that the blood pressure should come down. And it also reduces the oxidative stress. Then atherosclerosis is what we discussed is the hardening and narrowing of the blood vessel. Now, what the researchers have found, that when a person practices yoga, so he tends to adopt healthy eating habits. So you stop eating junk foods, you start developing dislike towards junk food, and you start liking healthy food. This is what is the beauty. So no medicine or no counseling can do that. But practice of yoga, so inherently you start liking healthy food and you start hating unhealthy food. Okay, by doing that, the cholesterol level in the blood goes down. Okay, and of course, yoga also promotes the adequate physical activity. By doing adequate physical activity, the cholesterol level goes up. By doing that, the narrowing of the artery becomes reduced. The arteries becomes more elastic, more flexible, so that they can tolerate the increase in the blood pressure, and blood pressure can be maintained in normal state. Okay, so this is how yoga can help in reversing the internal pathology. So internal pathology is this. So no one medicine can make all these changes, but yoga is a one intervention that can make all these changes. So yoga not only reduces the blood pressure and heart rate, it also corrects the inner imbalance which has happened because of the hypertension, and in fact which is the responsible for complications of the hypertension. So this is what is the beauty of the yoga. That is why I say yoga is a comprehensive intervention in hypertension. Thank you. Namaste.
Thank you so much, Dr. Metri, for such a lucid and simple explanation of the complex body-mind mechanisms, and for that added emphasis you put on the practice of yoga for all-round balance. Once again, I would like to remind our viewers who have joined us live today to please feel free to post your questions through the chat box. We'll be very, very happy to address all your questions towards the end with all the panelists who have joined us today. And with that, let us move on to our next panelist, that's Dr. Laura Tolbanos-Rocha. And yes, can we please have her on the screen? Thank you. So Dr. Laura Tolbanos-Rocha is currently the proprietor of Kamalabari Yoga Studio in Las Palmas de Gran Canaria, Spain, where she organizes regular yoga classes and workshops and courses related to yoga psychology. She is one of those few clinical psychologists who blend yoga beautifully into their private practice. Her journey as a yoga sadhaka began way back in 2002. She has a doctorate in clinical psychology from the University of La Laguna, Spain, and is currently associated with the research group of the university's Department of Clinical Psychology, Psychobiology, and Methodology. A well-published researcher, her area of study is focused on the effect of yoga on the psychophysiological and emotional symptoms of hypertension and related subjective well-being. She is a certified yoga instructor by Sharak, Spain, and Kevledham Yoga Institute, from where I'm speaking to you right now. She also has yoga certifications from the Bihar School of Yoga in India, the Chinmaya Mission UK, and the International Center for Yoga Education and Research at Puducherry, India. Today, Dr. Laura will share with us how the psychology and emotions of the individual play a role in hypertension, and how yoga therapy can contribute to the management and prevention of hypertension through self-regulatory, psychological, and neurocognitive pathways. Over to you, Dr. Laura.
Namaste, everyone. I would like to thank the American Academy of Yoga and Meditation for organizing this International Yoga Conference aligned with the International Day of Yoga. It is a privilege for me to join you all in this remarkable event. My name is Dr. Laura Tolbanos. I am a psychologist yoga practitioner and a yoga teacher. And today I will be happy to share with you some ideas, some concepts on the role of yoga in hypertension from a psychological perspective. Let's start with the presentation. The association of the development of arterial hypertension and the high reactivity of the cardiovascular system to stress has been well established. However, the role of the repression of painful and negative emotion has also been proposed as a trigger of this condition. In both cases, it's an overactivation of the sympathetic nervous system with the corresponding blood pressure increase. If the exposition to the chronic stress or the emotional repression becomes a chronic situation, this will lead to the development of arterial hypertension. In many cases, genetic and lifestyle factors play an important role too. In addition, the allostatic load suffered by the organism while facing the stressful challenge in order to maintain a dynamic balance makes this situation worse. Talking about stress, high reactivity, and repression of emotion, yoga can help in a wonderful way in the prevention and management of hypertension because yoga is a mind-body approach to health that comprises physical practice, breathing practice, and more than that, the science of pranayama as a means of awareness of the vital energy or prana, as well as the relaxation and meditation practice. But yoga is more than just a system of practice. Yoga is a way of life, leading to achieve physical, mental, social, and spiritual well-being in a conscious and evolutionary way. Therefore, the application of yoga in hypertension as well as in other pathologies has to be taken as a holistic approach which take in consideration all the aspects related to health, diet, lifestyle, environment, physical activity, breathing, and cognitive processes. Moving on to the psychophysiological mechanism of yoga in hypertension prevention and management, these are mainly based on two pathways. One is healthy habits because yoga promotes physical activity, natural diet, avoidance of toxic substance and risk behaviors, and stress management because yoga involves a set of techniques to prevent and cope with stress, mainly inducing a relaxation response. Yoga practice increase the parasympathetic nervous system and GABA activity and decrease or reduce the reactivity of the hypothalamic pituitary adrenal axis and the allostatic load, resulting in a balance of the autonomic nervous system. In more detail and related to the psychological and neurocognitive mechanism of yoga, we found in our studies that in addition to the significant decrease of blood pressure, an improvement of self-awareness and emotional regulation, mainly based on the enhancement of body awareness and mindfulness ability. Yoga practice develops the bottom-up information processing, what we call the conduction function, versus the top-down or construction function. Let me show you. Yes. The top-down information processing predominates in the human being, connecting the perceived information with our previous experience, labeling them and transforming the original perception in a more subjective and processed one. However, yoga practice develops a mindful attitude which allows a more objective perception of the experience, enhancing the bottom-up processing. The sensory experience is conducted as an energy flow. This awareness process will facilitate a more objective knowledge of the reality as it is, and the balanced integration of the internal experience in all corporeal, cognitive, and relational aspects. Additionally, when we are able to observe the experience in an objective way, one realizes that everything is in a continuous process of change, and sensation, emotions, and thoughts are constantly transforming. Then we can develop a decentering attitude, which permits this identification with what is happening, reducing reactivity and improving acceptance. This identification is actually a metacognitive process which creates a distance between the stimuli and the response, giving you the freedom of choosing a conscious and voluntary response instead of an automatic reaction. The balance between both functions, bottom up and top down, could be the basis of a personal integration, internal balance, and emotional regulation, as well as the achievement and maintainment of a state of well-being. This integrative process is a self-regulatory process in itself. We also found in our study that the enhancement of all these abilities, body awareness, mindfulness, decentering, correlate with the decrease of anxiety and depression symptoms highly relate to the essential arterial hypertension. Besides that, yoga intervention have shown a positive impact improving systemic biomarkers of neuroplasticity in healthy and stressed individuals, as well as in major depressive disorder. The enhancement of neuroplasticity leads to cultivation of healthy and positive mental habits, cognitive process and behaviors, and improve resilience and well-being. I would like to finish my presentation summarizing the positive action of yoga in prevention and management of hypertension with three important concepts that I have called the 3 E's: embodiment, empowering, and emotional regulation. Embodiment because yoga improves awareness of the feelings, sensation, and their relations with the emotions and thoughts. We realize that cognition is not separate from emotion and feelings. Empowering because yoga promotes a self-care attitude and commitment with the one's health. Self-responsibility leads to positive changes in habits, cognitive process, and we realize that the transformation occurs from inside. And finally, emotional regulation, because yoga practice develops a new relationship with oneself based on awareness, higher objectivity, and integration of all the levels of the experience: physical, emotional, cognitive, social, and spiritual, leading to a sense of acceptance, a sense of coherence in life, an openness attitude, and finally to inner balance. That brings me to the end of my presentation. Thanks so much for your attention. Namaste.
Thank you so much, Dr. Laura. Embodiment, empowerment, emotion regulation. So well summarized as the 3 E's of yoga's psychological action. Thanks a lot for letting us know the power of self-regulation that yoga offers to its practitioners. So that completes our great lineup of panelists there and whatever they had to offer to you. And now it is your turn to engage with them, all my viewers who are joining us. And I'm sure you have a lot of questions that you want our panelists to answer for you. So now I'm going to start taking up some questions. So we have a question here, and I would request Dr. Metri to come online and take up this question. I will just read out this question. So it's from one of our viewers. Is there any study providing benefits of left nostril breathing in hypertension? For how much time should one do these breathing exercises? Dr. Metri.
Yes, it's a very good question. Yes, there are studies, there are a very good number of studies which shows the unilateral breathing effects on the physiology of the system. And there are few studies which particularly done in patients with hypertension, that left nostril breathing, or it is called as Chandra Nadi pranayama, is very effective in reducing blood pressure and heart rate in patients with hypertension. Now, what study has shown is now the method how we should perform left nostril breathing is we should take minimum 5 seconds to inhale, 5 seconds to exhale. That is one breath in 10 seconds. That is 6 breaths per minute. If you could able to continue it for 27 rounds, it definitely produces reduction in the blood pressure and heart rate among the patients with hypertension. This is the research study. Now, from my experience, what I would suggest is for those who are the beginners. So you start with 10 breaths or 10 cycles of Chandra Anuloma Vila or Chandra Nadi Pranayama for 5 days, and then gradually increase it, and you reach up to 27, and you can go beyond that, and that will definitely have a very good positive results in reducing the blood pressure. Hope I answered the question. Thank you.
Thank you very much, Dr. Mukherjee, for answering that question in such a simple manner. And I have the next question for Dr. Ratna. If she can please come online. Do we have her online? Okay. Thank you so much, Didi, for coming online. So I have a question from a viewer here. Can you please suggest yoga for hypertension-related headaches? Didi?
Hypertension, am I audible? Hypertension related headache is also because of too much of brain work. Again, I go back and tell you, please look into your lifestyle. Timely meals, timely going to bed, and when you are going to bed, what is happening to the mind? Is the mind very, very active? Is the mind very, very speeded up? Replace it by slow breathing. In fact, we call it a sleep special technique. Before you go to bed, you do a little brisk walking beside your bed with slow breathing, with awareness of the bodily changes at your feet level, at your breathing level, and then sit at the edge of the bed. Do Nadi Shuddhi Pranayama or alternate nostril breathing 9 rounds and keep on listening to a very soft, gentle music that you love and shift your awareness to the body level and feel that resonance of the music all over your body, and that gives you good sleep. So at least 6 to 7 hours of sleep is very necessary to prevent the headache. If you have already got a headache also, there are what are called as headache special technique, in which, as I showed you in the picture, you do the physical practices for 20 minutes, which does not involve too much of head down positions, followed by deep relaxation, quick relaxation, and also cyclic meditation, which is going to make a big difference. The big problem is we have to have regular lifestyle, timely get waking up, timely meals, timely breakfast, timely job activities. Even if you want to work 18 hours a day, it's okay, but have it on a regular basis. And that's what is going to prevent the headache, cure the headache also.
Thank you so much, Dr. Nagaratna Didi, for emphasizing how these practices, like simple breathing practices and the other practices that you mentioned, how they can help you get sleep and also minimize your headache, maybe even let it go. So let's take one more question from our viewers. And I would like to remind the viewers, please send in your questions. We are very, very happy to address them with our panelists. So the next question, I would like Dr. Laura to come in. If a patient is habituated with medicines for high pressure, that is high blood pressure, can regular practice of meditation and pranayama let him or her cease medicine permanently?
Namaste. Thank you for the question. I don't recommend, I don't suggest in the medication. Yoga therapy has to be understood as a complementary therapy. And just in case with the practice of, with the regular practice of yoga, the condition is reversed, then you can think to maybe remove the medicine, but always under consultation of the physician. This is what I suggest.
I would like to add to that. We have had large number of people who come to us for learning yoga for hypertension. While they are under supervision, the BP comes down, and I am also able to reduce their medication to some extent. But my biggest worry is when they go back, are they regular? Are they following it up? Are they doing it, their practices regularly? Are they going to majorly stressfully demanding situations? How the mind is reacting? How their lifestyle is maintained on a long-term basis? If that does not happen, their BP goes up, and this is the reason why we should always be cautious about trying to reduce their medication. If they are on very, very regular lifestyle change with monitoring under the supervision of a yoga therapist or even a doctor, then definitely the medication dosages will come down. But a very big caution is that don't do it on your own, as Lara said.
Thank you so much, Didi, for adding in there. We have one more question there from the viewer. Sometimes I feel that I couldn't recall things properly. How can yoga meditation help to re-establish my memory at the time of remembering? Anybody of you can take that question.
I think Didi can.
You have experienced something very interesting in many times. We all have experienced this. I am trying to get somebody's name. I am trying to remember something. I struggle. My God, what's it? And suddenly you say, let go. Forget about it. Let me move on with the next thought. And within the next 10 seconds, you'll get back the flash. What did you do? You switched off the mind of intense focusing. What's it? And that is blocking your memory. So to get back this short-term memory or long-term memory, also silencing the mind is the trick. Once you go on to, this is a short-term experience that we all have experienced in our lifetime. So what the sages said is, go to that state of deep silence, regular meditation, automatically the inner layer of your Vijnanamaya kosha or the subconscious memories store home, you will dive into that and all the memory comes back.
I would like,
Yes, Dr. Laura.
to add something, because I think meditation improves your attention ability. So attention is very related to memory. Then definitely meditation practice can improve memory by this pathway.
Kashinath can quote some of the research that we have done on improvement of memory.
Sorry?
Yes, yes. Thank you, Didi. So we have done lots of research, particularly assessing the impact of yoga on memory across the different, diverse populations, right, from the children, children to elderly. And what we found is very positive effects of yoga on memory. So so how that happens is like when we practice yoga, this practice of yoga requires a lot of attention, lot of mindfulness. So when we do asana, we have to focus on the our position, our breathing, our steps, all that. So all that makes us to insist, keep on doing this exercise of remembering and being focused on the body positions and all that. So that actually enhances not only memory but also the whole set of cognition. So this is how yoga definitely enhances the memory, and the people, we have experienced that people notice change in their memory, like enhanced memory within even 1 week of period following the yoga meditation.
Thank you, Dr. Kashinath. And I wish we can just continue this discussion for a very long time. And there can be so many questions, coming. And in fact, I had a question, but I think in the interest of time and the interest of YogaCon and the whole team of the American Academy of Yoga Meditation, which is working so hard, I think we have to close this session. So what a wonderful learning experience it has been for me personally, and I'm sure for all the viewers out there. So thank you so much for this wonderful learning experience. And our hope at AAYM is that we all can start practicing yoga and make it a part and parcel of our life so that there is no BP, no hypertension, no heart disease. We are just fit, healthy, peaceful, and harmonious. And with this, I would like to hand over the reins of the session to Dr. Raji.
Thank you very much, Dr. Praseeda Menon. So it's my great privilege to now thank everyone who has worked very hard to make this session a very interesting, enlightening, and inspiring session, giving us so much information and inspiration to try and use these different suggestions and advice that was given to us in our daily life. So first of all, let me thank Rupa ji, who is the coordinator for this entire week's programs. I want to thank the four very interesting speakers, Dr. Robert Schneider, Dr. Nagaratna, our favorite Didi, Dr. Laura Talbanos Roche, especially for staying so late into the night, and Dr. Kashinath Metri for your very interesting talks. Dr. Praseeda, thank you so much for moderating this session. And I want to give a special shout out to our tech support, Dr. Anjali, Sagar, Siddharth ji. Thank you very much. And I would recommend our viewers to check out the AAYM website and please look for more information and also the coming sessions. We have more sessions, one more session tonight and then more sessions next week. So thank you and namaste.